The following program contains mature subject matter and coarse language. Viewer discretion is advised.
On this edition of The Fifth Estate, we're in Vancouver's downtown east side, the epicenter of a poison drug crisis in Canada. Since 2016, more than 4,000 people have died of opioid overdoses in this city. More than 50,000 across Canada. The main killer is fentanyl.
I was overdosing like upwards of twice a day. I think the way that I'm going now, like I could die any day now.
Down here, it's Russian roulette.
A panicked response that involved prescribing millions of pills.
It wasn't working. The dose was too low.
We're spending hundreds of millions of dollars on our treatments and they're not working.
And sometimes ended up in the wrong hands.
These guys are counting pills right here. There you go.
Did politics get in the way of saving lives?
I think people have been manipulated politically by certain actors who want to stoke fear.
We talked to experts who had the ear of the Prime Minister.
We had the highest people in the government intrigued by this idea.
And reveal why it all fell short.
Safe supply itself is not a failure. Safe supply has never been tried yet.
If this was happening to another group of people and we could do something about it and we've chosen not to.
It's a crisis. We need help.
I'm Stephen D'Souza. This is The Fifth Estate. What does a person who uses drugs look like? It's not always what or who you think. Each one carries their own story and faces their own unique set of challenges, often masking years of pain and trauma at the root of their addiction. So, I mean, even as we're talking now, you're already thinking about where you have to go or how you have to get your next...
Yeah, it's constantly on my mind.
I meet TJ Felix in Vancouver on a Friday in September around noon. They say they've already done 2 shots. Just one would have been enough to kill me. Some people have this idea of what a person who uses drugs should look like after taking drugs, right? Like there's no...
Do I look like kind of a dope?
No. What do you say to somebody who may have that stereotype in their head listening to you now?
I mean, we come in all shapes and sizes. I mean, drug users come from all walks of life. I am a Two-Spirit Kalmuk, indigenous to the interior of BC. We're each individuals, and we have our individual needs. And I think medically that means acknowledging that we have specific drugs that we use, and if we're not given those exact drugs, then treatment doesn't work.
They get their drugs on the street because, like so many chronic drug users, they don't have a safe, regulated option.
If I had a steady, reliable, dose from a doctor or something, but that's not something that's really possible for me at the moment. It's a matter of life and death, really.
TJ Felix grew up beside Eagle River and Shuswap Lake in BC's interior. They say they were exposed to drugs and alcohol earlier than anyone should be.
On and off since I was about 9 years old, I've struggled with alcoholism and chronic drug use. Yeah, I had a pretty fucked up childhood, I guess you could say. Yeah.
By 2007, at the age of 18, TJ was living in Vancouver, creating music and art at a prolific pace, but also falling in and out of treatment programs.
I think that it's entirely possible to be a functioning and contributing member of society while being a chronic drug user, but it's also a very fine line, I think, that I've crossed many times.
Tonight, TJ is heading to a rehearsal for an upcoming show. Just steps from their Vancouver apartment in the trendy Mount Pleasant neighborhood, they lean into a familiar ritual.
Music still helps me get through the day. It's how I communicate, really. I love making music.
If music is their healing ritual, it's in contrast to their other ritual. Today, TJ uses a dangerous mix of fentanyl and methamphetamine 10 times every 24 hours.
The euphoria is long, long gone. I don't really get any pleasure out of using. It's just something that at this point has become a substitute for community and therapy and everything else that functioning adults, need in their daily lives.
TJ says using also keeps away the painful and dangerous symptoms of withdrawal.
I would kill myself if I had to go through intense withdrawal. Again, it's something that you avoid it at any cost. And the worst, deepest level of addiction is when you're just using to avoid that. It's no life at all, really, when it revolves just around you not being sick.
TJ was one of thousands of drug users caught by surprise when fentanyl began to take over the drug supply. The synthetic opioid, which is up to 100 times stronger than morphine, was a cheap and convenient way for dealers to make more potent drugs. In British Columbia, overdoses nearly doubled between 2015 and 2016, and provincial officials declared an emergency. Mark Tyndall is a physician whose research put him on the front lines of the HIV and then the drug crisis in Vancouver.
At one point, there were 2 or 3 deaths a day in the downtown east side. And in the province, there was 6 or 7.
So we knew something had rapidly switched, and a lot of the deaths had no heroin at all. It appeared that people were now using fentanyl.
By 2016, fentanyl was showing up in 2/3 of the nearly 1,000 drug deaths in the province. The pharmaceutical once used for chronic pain and post-surgery was being mass-produced by organized crime in clandestine labs, flooding the streets.
So 2017 doubled again, 2018, and all of a sudden we're up to like 2,000 deaths a year. And 80–90% were all fentanyl and toxicology. It had a very chilling impact. Everybody felt at risk, and they were at risk if they were buying this on the street.
Tyndall's patients were among those at risk, including Mark Desjarlais. Chronic drug user, he's known Tyndall for 25 years.
I wouldn't be here without him. He really saved my life. He did more than what a doctor should, He went above and beyond to help me, and I appreciated that.
Tyndall's help came at a time when the crisis was making daily headlines.
Deaths caused by overdoses of opioids and other drugs.
With a public health emergency declared in BC,
this is an extraordinary challenge.
Overdose fatalities in the province are going up, not down.
As the death toll kept climbing, Tyndall started prescribing patients like Desjarlais hydromorphone pills, an opioid also known under the brand name Dilaudid. It was a drug already regulated and approved, though not for chronic opioid users.
It was easy to prescribe, it was readily available, it was cheap, and it was already established on the street. So Dilaudid had already become kind of part of the drug economy. Knowing that I could write them a prescription for an opioid that wouldn't kill them, I just felt that was the only ethical thing that I should be doing.
For Desjarlais, having an alternative to the street supply was like dodging a bullet.
What did it mean for your life to be able to be on that program?
Make things easier and, you know, do something that's clean and know what's in it.
When you don't have a safe supply, or when you don't have it, you know, in that way, where does your supply come from, or how?
Just from the street, I guess.
Just from the street, yeah. Does that concern you, not knowing sometimes where it may be coming from?
I try not to think about it.
Yeah.
You know, I mean, down here it's Russian roulette, I guess.
But these tiny 8-milligram pills couldn't help everyone. For Tommy Koritsaris, who's been using in Vancouver for over 22 years, it wasn't enough.
It's very difficult to come off fentanyl and supplement it with some kind of pill.
Coming up, what happens when the government turns its attention to the crisis and funds alternatives?
Will the Prime Minister cancel the dollars for drugs?
Just stop it and save lives!
And we'll show how the fallout was being felt on the streets.
Oh, I've seen them exchange pills, I've seen them do crack, and they look around like, oh, nobody's watching. What do you mean? The whole world is watching.
Claudia West has traveled the streets of Vancouver's downtown east side for 14 years. This is home. The people here, her family.
Wow, that's going to be a lot more homeless people.
She is a chronic drug user, and 3 times a day she makes a journey for a safe supply that keeps her stable.
When I was really sick 4 years ago, they asked me if I wanted to join, and I go, really?
Then that's okay too.
Here she gets an injection of diacetylmorphine, pharmaceutical heroin. She's part of an injectable program helping 83 chronic drug users. This model was the first of its kind in North America.
I joined it, and it's pretty good. Yeah, it's been keeping me clean for December 9 will be 4 years.
4 years clean.
From street drugs.
Yeah. So tell me about the street drugs. What were you using before?
I was using heroin and fentanyl.
Yeah.
And the benzos in it, you know. It was getting pretty bad.
In 2021, while in hospital for a serious infection, she was approached with a chance to join the program. How does it help you?
Well, it keeps me clean from street drugs, which is a big thing. Yeah.
Is it about the high, or is it about just...
It's not about the high. It just makes you, it just makes you feel good. Like I get stiff every day when I wake up, and the shot loosens my body. It just loosens it right out. Yeah.
All right, so tell me about this poster.
Yeah, so this is a copy of the original advertisement we launched Safe Supply in. So we took out a full-page ad in the Georgia Straits about safe supply and why it was needed.
Back in 2018?
2018, yes.
Wow. While Crosstown had been running its program since 2005, the term safe supply didn't enter the conversation until 2018, thanks in part to Jordan Westfall. I guess the message in the middle there is quite clear. People never have to worry that the next sip of beer they drink will kill them. Why can't we all have that safety?
Yeah.
At the time, he was a high-achieving university student. But in private, he was hiding an addiction.
It felt at times I was living almost a double life, right? Honor student, sort of respectable, and then the other side, you know, seeking drugs on the streets and just the sort of sometimes agony that comes with it, you know.
Westfall got sober and came to Vancouver to tackle the drug crisis. He entered grad school in public health.
It seemed very clear to me that everybody was using these drugs, that they didn't really know what was in them. As a person who used these drugs, that when you know what they are and they're predictable, you're way less likely to overdose.
For Westfall, safe supply meant legalizing and regulating opioids, stimulants, and hallucinogens. He outlined his ideas in this 2018 concept paper. which also included expanding access to the kind of pharmaceutical heroin Claudia West was using at Crosstown.
That program proved it. The evidence proved it. This idea caught on pretty quick. Within a year of us sort of launching this term safe supply, I was, talking to the Prime Minister about it less than a year later. It started to create just a rallying cry for people on the streets who really needed this.
In 2019, Health Canada created an expert advisory group to provide input on proposed pilot programs. Westfall was made co-chair, pushing for legal and regulated drugs. But he quickly realized the group wasn't willing to go that far.
Take this drug we already have, just give it out to people, and it's fine. Problem solved. The thing is, 50,000 people have died of overdose to preventable death in this country. Everything needs to change.
Westfall realized that even having the ear of Prime Minister Justin Trudeau wasn't enough.
So we're presenting and encouraging safe supply to the Prime Minister, who's asking what's the strongest evidence, what are the options with the strongest evidence, and we took them through the concept paper. But at Health Canada, on this expert advisory group, the conversation is different.
Health Canada supported hydromorphone pills as safe supply. They were available, easy to dispense, and some research showed they led to less street drug use and fewer overdoses. But internal notes obtained by the Fifth Estate show advisory group members flagged the potential for diversion as early as 2019 and highlighted the success of options Westfall supported.
We know now, and we knew then, that these tablets are not as strong as a drug legal and regulated for someone specifically using street fentanyl. It'd be like, if you have a cup of coffee every morning and we took your cup of coffee away and just gave you a teaspoon of coffee and said, try and start your day with that. For most people, it wouldn't work.
But it's a fight you want to take on.
Yeah.
Claudia West also knew that the pills, often called dillies, didn't work for everyone.
One of the things we've heard is that people say the people who have prescriptions for Dilaudid, they take those drugs and they sell them elsewhere.
Yeah, a lot of them do. They trade it for dope. Yeah.
What do they trade it for?
For heroin and coke.
Yeah.
Do
you see a lot of that?
Yeah.
How often do you think that happens?
Every day.
Yeah.
Every day. Yeah.
What West described is called diversion, the selling of prescription pills to others. This sparked debate about the intent of safe supply. Supporters said diverted pills were still safer than the street supply.
My common sense plan to put the
But opponents loudly called on the federal government to shut safe supply down.
The Prime Minister has spent $100 million on so-called safe supply. Turns out they're being resold to other addicts in order to raise the money to buy deadly fentanyl. Will the Prime Minister cancel the dollars for drugs and instead put the resources into treatment for addicts?
Mr. Speaker, we are pretty fed up with this fight against evidence-based programs that actually are saving lives. We cannot allow the Conservatives to take us back to the failed ideology of the past, so just stop it and save lives.
In BC, the opposition Conservatives leaked a report revealing the NDP government knew safer supply pills are not being consumed by their intended recipients. Were being diverted and trafficked. They had proof from vehicle searches. They also identified 60 pharmacies offering incentives like cash to patients. In London, Ontario, where some local doctors had been trying out their own versions of safe supply, diversion made headlines when police seized over 11,000 Dilaudid pills in 2024.
The prescription drugs are being used as currency, and individuals are using the diverted safe supply to obtain fentanyl.
These guys are counting pills right here. There you go.
And in Ottawa's Chinatown, one clinic became a flashpoint in the diversion debate.
Oh, they're doing crack right there.
And a neighboring store owner had had enough.
Uncomfortable. I've had employees quit because of this, because they threaten them when they say, hey, please move in front of the door.
At the time, Fadi Daya captured surveillance outside his cannabis shop.
People who are going to watch this are going to think it's ironic that, here you are selling cannabis,
Yeah.
but you're complaining about drugs.
Yeah, but this is not a hard drug.
Yeah.
Cannabis is not an addiction. These drugs are addiction that could take control of a human.
He showed us videos he captured of what he believes are safe supply pills being exchanged in drug deals, involving people from an addiction clinic a few doors down.
You've seen people just exchanging the pills that they've just gotten.
Oh, I've seen them exchange pills. I've seen them do crack. Sometimes these guys, they think they're smart. They step away from the building. They come over here or over here, and they look around like, oh, nobody's watching. What do you mean? The whole world is watching.
Ottawa City Councillor Ariel Troster has also watched firsthand the shift in her community.
Immediately, within days of coming into the neighborhood, an entire criminal ecosystem developed around the clinic. Immediately, and it was obvious to everyone.
You were seeing diversion happening right out in the open?
Absolutely, we all did. Literally, we would see people walk out of the clinic, pull out their bottle, somebody else counting pills, we would see the exchange.
When you were on the panel,
none of this came as a surprise to Jordan Westfall.
Was there a warning, or did they have a sense that diversion would become an issue?
Yeah, absolutely, absolutely. And I think there was a sense of we need to reframe this to the public.
So the discussion wasn't, let's try to avoid this from being diverted, let's try to reframe the messaging around it?
Yep, I'd say that's exactly right.
Coming up, one Vancouver doctor gives patients what they need.
This is unprecedented in the history of opiate prescribing. The Dilaudid didn't get people out of withdrawal. I had to switch to a fentanyl product in order to alleviate those withdrawal symptoms that are so uncomfortable for people.
A lot of times my day is reduced to working on my art and using alone. Drugs have kind of become like a substitute for a lot of important things in my life. I have to do enough drugs to kill, that would kill any other person. Otherwise it just isn't manageable.
For Safe Supply to work, it had to reach users like TJ Felix. But they say the types of drugs the program offered simply weren't strong enough to help them.
It was a complete failure as far as I'm concerned. It didn't do anything to stabilize me or, it didn't meet me where I was at in any way, shape, or form. If they just gave drug users the drugs that they need to function, there wouldn't be diversion.
As diversion of Safe Supply medications took over headlines and tilted the debate against Safe Supply, TJ retreated to the streets.
I think the way that I'm going now, I could die any day now.
The program can never solve a problem that's created by policies.
Christy Sutherland is a family doctor working in the heart of Vancouver's toxic drug crisis. In the early days of Safe Supply, she tried the government-approved hydromorphone pills, but soon realized at least 40% of her patients were not taking the pills she was prescribing.
It wasn't working. The dose was too low and it didn't help the patients stabilize or help them get away from fentanyl. Really, they needed a higher potency medication to help them stay away from withdrawal.
Sutherland chose to end the program after 2 years and worked on what she hoped would be a more effective alternative. But that meant cutting off her patients from Dilaudid, and for some of them, this meant a loss of income since they were selling the pills.
If I was getting free wine from my family doctor, and then if my family doctor stopped it, I would be really angry at them.
The violence got to the point where your life was threatened?
Yeah, so we had to make the clinic all telehealth, and I had to leave town for the safety of the staff and myself.
Instead of backing down, she came up with a revolutionary alternative.
So we worked with a pharmaceutical company and a local compounding pharmacy in order to create a new fentanyl product that's both smokable and injectable. I think it's the first smokable pharmaceutical product that's ever existed.
It's not easy. Why do that?
Well, because we had nothing else at the time.
She started off prescribing low doses, but soon learned just how high some patients' tolerance was.
My first guess was 250 micrograms. I based that on the drug checking systems here in Vancouver, and the patients who we started said they couldn't even feel it.
So you went from 250 to 20,000.
Yeah, I never would have thought. And so now we have people on 20,000 micrograms of fentanyl per dose, which is just an astronomical dose that I never thought I'd ever be prescribing in my life.
To put this in context, getting fentanyl at the hospital for a broken leg might be 50 to 100 micrograms. Sutherland was prescribing 200 times that amount. She helps just 70 people in her research program.
So for my patient population, there's a rigorous intake process with an interview with the physician, they're urine drug tested, they see the nurse, they see the pharmacist, and then we observe them to figure out what their individual dose is, and then they can enter into our fentanyl or heroin sales programs, where they can purchase their drugs from the pharmacy for a little bit higher than what is the street cost to prevent them from selling it onward, but that they know it's a pharmaceutical version of the drug with no contamination, and it's a way to exit street life.
Safe supply, or we die!
She wasn't the only one trying to find an alternative to the Safe Supply program. Others faced criminal charges for trying to help users. In October 2023, Jeremy Calcom was arrested for drug trafficking after operating a compassion club which sold a clean supply of drugs to users. They called it the Drug User Liberation Front, or DULF.
We wanted to get a realistic picture of what would happen if people had access to a regulated supply of substances that they had to purchase.
Calcom had seen the impact of an unsafe supply through his brother, who began using while working in the trades and recovering from injury.
It's very personal because when you have somebody in your life who uses substances or uses substances in a chaotic way, you realize that the most important thing when they're in sort of chaotic use patterns is that they stay alive.
With a master's degree in public health and experience working and testing drugs at overdose prevention sites in BC, Calcom worked with co-founder Eris Nix to create a safe alternative in the downtown east side.
People really just had no resources or way to keep themselves safe.
The government had been doing its own safe supply program with Dilaudid pills. Why not rely on that?
The drugs that they were providing weren't sufficient, and that's something that we were telling them, that you're going to give people drugs that they don't want.
The club had to source drugs from the dark web, tested them at university labs, and then sold uncontaminated heroin, cocaine, and methamphetamine to a select group of members.
We had exemptions to the laws. We had overdose prevention site designations. What we explained, what we were doing, and how it was understood was a form of drug checking for people. We talked to the police. We talked to the health authority. We talked to the local government. We talked to the provincial government. We talked to the federal government.
What did you start to see? What were the impacts?
We saw that people overdosed way less. We didn't have anybody die, but we also saw things that we weren't expecting. We saw people that were accessing the club stop using drugs once they were able to gain that stability and not have to be like kind of flailing around trying to find substances or getting ripped off. People had to commit less crime if they were committing crime. They had to do less sex work. They interacted with the police less. They interacted with the hospital system less. People felt like they were more stable in their lives.
Like, I'd be dead 10 times over if it wasn't for them.
TJ Felix was one of just 24 people who were part of the first trial.
DULF was like a huge part of my social life and communal, like community building, and my gateway to the community really, and to just be around people every day.
Calcom and Nix were found guilty of drug trafficking in early November, but that's not the end. They filed a constitutional challenge, arguing drug users have a right to safe supply.
We think there's a real constitutional issue here that needs to be addressed if we're ever going to get to the point where we don't have thousands of people dying every year from preventable deaths. It's our friends, our family, and our communities who are at risk of dying.
The day that they raided the DULF office, that was a pretty crazy day for you, wasn't it?
Yeah, so pretty bad day. Yeah. I showed up and I hadn't scored or didn't do my shot for the morning because I, was expecting to go into work and to be able to buy some. I started going into a panic, and all I could think to do was to buy fentanyl, and I'd never used fentanyl in my life. Had no idea how to use it, how much to use. For the next 2 months after that, it was all in a fog of paranoia and drug ODs. Like, I think I overdosed, at least once a day.
People lost their homes. People got in trouble with the law. People died.
People died after getting cut off from your program?
People died.
Blue streets are free! No more dying! No more dying!
Every policy change originated with people having the clarity to break unjust laws.
Both Sutherland and Callacum published peer-reviewed studies. They also say no one died while using Safe Supply in their programs.
Was there any data or policy or medical reason for shutting you down, do you think?
It was politics. It was 100% politics and fear of public outrage.
Coming up, caving to political pressure.
Our governments don't have the courage to stand up and say, this is what the physicians tell us, this is what the science tells us, this is working.
And were the answers in plain sight?
The evidence was absolutely clear that this was a treatment that could help people. We tried so many times.
Now I don't have any capacity, especially with time, in order to even think about recovery. Because I'm constantly worried about where the next hit's going to be coming from.
What do you say to those critics that say that, people like yourself should just go right into treatment and they shouldn't be given, safer supply of drugs?
Well, they should spend 24 hours in my boots and see what they think after that.
What would they learn?
It's a hard life. It's not made for everybody. Every person has a different set of problems. And just slapping us into treatment wouldn't help.
Mark Desjarlais and TJ Felix are at the mercy of a fierce political debate. Chronic drug users seeking access to a safe and regulated supply to stay alive.
I don't think that we deserve death. I think we deserve a lot more than what we've been given.
Opioid overdose deaths have climbed to 18 per day in this country. Fentanyl continues to flood the streets, found in 63% of those who die. More than 2.5 million Canadians used illegal drugs in the last year, and though any of them could be at risk of an overdose, based on provincial data, less than 1% are accessing safe and regulated drugs.
I think people have been manipulated politically by certain actors who want to stoke fear, and that has really pushed us back.
Martin Schechter is a global leader in population health. In the early 2000s, he led 2 landmark studies that examined alternatives for people with severe opioid addiction. In the first, he tested pharmaceutical heroin, also called diacetylmorphine.
Well, in Germany, Holland, Switzerland, England, they use this as a treatment for people who have opioid use disorder. So the evidence was absolutely clear that this was a treatment that could help people where the existing treatments were not helping. They stayed with the treatment far more than people who had been assigned to methadone. The second thing the study found is that it's actually cheaper.
Schechter says access to medical heroin was never scaled up because of political fear.
It has so much stigma associated with politics and moral panic and fear-mongering that government officials were afraid to fund it.
So he tried something else, injectable hydromorphone, which contains the same active ingredient as Dilaudid pills.
To our surprise, they did as well as people who were receiving diacetylmorphine.
In 2019, This research prompted Health Canada to approve both injectable heroin and hydromorphone for opioid use disorder. Despite this, only a few hundred people, like patients at Crosstown, have access to it.
We tried so many times to make an argument that this should be adopted as a treatment. We presented our data to municipal health authorities, provincial, federal government, but we were unable to ever convince them to make this as useful as it has been in Europe.
Jordan Westfall, who co-chaired the expert advisory group on safer supply, pushed for these alternatives. Was that evidence looked at or was it ignored? How would you describe, having all of that information already out there, then not being implemented?
It was kind of heartbreaking because we had solutions that were available. We had evidence that showed them, and it was being ignored, and it was incredibly frustrating.
That expert advisory group ended its work in 2023. The Fifth Estate requested their final reports to Health Canada. They refused to share it. We then found a redacted version on the Government of Canada website. We did obtain, though, a clean version of the report, and we can now share with you what wasn't released publicly. They said Canada's overdose crisis is driven by prohibition and an illegal market, and that prescribed medications like Dilaudid do not meet the needs of all drug users. They recommended expanded access to more prescription opioids and stimulants, and said the government should consider legal and regulated compassion clubs and retail stores. The Fifth Estate, though, has found no evidence that any of these recommendations have been implemented.
Prime Minister, if things go well with the BCD...
Every step of the way we need to make sure that A, we're following science and data, and that's exactly what we're doing.
Despite advice from Health Canada's chosen experts, it wasn't enough to bridge the divide between science and politics.
I'm not a fan of the federal government's safe supply. I compare it to giving people poker chips, dropping them off in front of the casino and saying, go to town.
We in our province, we don't believe there's such a thing as a safe supply of heroin in any of its forms.
And even in BC, where more people are dying of toxic drug overdoses than in any other part of the country, safe supply is still a tough sell.
Lisa Lapointe, the former chief coroner, and your own provincial health officer, Dr. Bonnie Henry, both disagree with you. They both want to see the safe supply program expanded.
I just disagree with them on that. I don't think that government distributing crystal meth, crack cocaine, and fentanyl through co-op is going to solve this crisis.
Our governments don't have the courage to stand up and say, this is what the physicians tell us. This is what the science tells us. This is working.
BC's chief coroner Lisa Lapointe resigned, frustrated that even expert recommendations in BC were ignored. How did that make you feel when you saw the government basically undermine all the work that had been done?
Here was a panel that had made recommendations, a blue ribbon panel that had made recommendations that they believed would prevent people from dying, and government just dismissed it out of hand. It felt more political than based on any attention to the science.
There is currently no national safer supply program. Funding from Ottawa has dried up, and there's no longer a federal ministry of mental health and addictions.
Safe supply itself is not a failure. Safe supply has never been tried yet. Safer supply is a failure.
To find out why government leaders disregarded the advice of so many experts, we requested interviews with former Prime Minister Justin Trudeau, former Chief Public Health Officer Theresa Tam, former Minister of Health and Addictions Carolyn Bennett, and the current Health Minister Marjorie Michel. They all declined an interview. Instead, Health Canada provided a statement about the future of prescribed alternatives known as safer supply. In it, they said, "These pilot projects have concluded, and there are no plans to fund new projects going forward." Undeterred, we went to a Health Canada announcement in Toronto, touting new money for the toxic drug and overdose crisis. In the place of the Health Minister, Parliamentary Secretary Maggie Chi.
Funding will provide a wide range of urgent interventions for those affected by the illegal toxic drug supply and overdose crisis.
Health Canada earmarked more than $36 million for projects, but no mention anywhere of safe supply.
I wonder if you can tell us if the government has given up on prescribed alternatives and safe supply. Is that the end of that program?
Indeed, this is an announcement I think that really gives hope to a lot of communities. It is a whole of government approach, right? We are working with all partners.
But to the question though, are we going to see any new funding for safe supply, or is that the end of funding for those programs?
Again, I think it's one of those cases when we talk about addiction and the overdose crisis, we really have to work with all partners on this.
But what do you say to people who use drugs who may not be in a position to get into treatment, who may now have to turn to the streets because they can't get a safe alternative?
That's an excellent question. I think this is when community partners really stepped up, right?
But will communities and provinces support safe supply if the federal government isn't willing to? I approached Parliamentary Secretary Maggie Chi one more time.
I just wanted to follow up just to get a sense if there is any more information on prescribed alternatives.
I would refer to, because I do apologize if I do need to run back to the writing. Actually, let's refer you to the media person, because I don't want to give you a brush off answer.
What's your message to the politicians and the people in charge of these things that could expand the program?
They should open more programs. It's changed my life.
Everybody is somebody's sister or brother. And it's just as easy as them to come down here and do the same things I do. If it was offered again,
You'd be right on that?
I'd be on it. We need help. We need a clean supply, and we're not getting it.
Throughout it all, TJ Felix is still holding on to hope.
I mean, it wasn't a solution at all. Tying livelihood up in politics, and it's got to end. It's just not right.
I mean, do you hope that people can overcome the stigma around people who use drugs?
I'd be dead by now if I didn't think so. I don't want to live in a world where that's not possible. We ever hope to have capacity, work on ourselves, and to even think about recovery, we need to be given, some grace.